The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hello folks, on today's show of Aging Horizons, we'll be talking about Medicare. What are some of the considerations that you need to think about when you're approaching Medicare age or certain circumstances happen in your life in which you will become eligible for Medicare? There are some certain restrictions and eligibility rules, but they're pretty basic once you are aware of them, and you want to sign up as soon as you can. We'll talk about that and so much more, so stay tuned.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Here in Montana, we love our outdoor activities. Unfortunately, few of them are risk-free. Indeed, Montana is second in the nation per capita in head injuries that can destroy the lives of people we love. That's why you should insist your family always wear protective helmets. But you can do even more. When you fill out your vehicle registration this year, circle the Y and donate $1 to support traumatic brain injury prevention and education. Now that's using the old noggin.
Providing long-term care for someone in need is a labor of love, but it is a labor. Time apart is healthy and necessary both for the caregiver and the person receiving care. It allows each a respite, time to relax and recharge. If you're a long-term caregiver, visit the new Lifespan Respite website. Financial assistance may be available. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services Senior and Long-Term Care Division. I'm your host, Brian Lamore, and we're talking about Medicare today. What is it? When do you become eligible? And what kind of benefits it does provide you if you become eligible through age or other circumstances in your life. Of course, we have a wonderful guest today from Butte, our Area Agency 5 Resource Specialist. We have Cheryl Petersley. Welcome to the show. It's great to have you here.
Thank you.
Great.
Great to be here.
Yeah. Well, let's start at the top. Many people hear the word Medicare and Medicaid, or they refer to Medicaid when they mean Medicare. Let's define what both of those are, if you could, please.
Okay. Yes. And we have people all the time that say Medicaid, of course, when they mean Medicare, and the same thing. So Medicare, federally based. If you've worked all your life or most of your life, you've paid into it. But it's health insurance, basically. Normally, when you're turning 65, within about the 3 months before, you should start looking into applying. If people are already taking their Social Security benefits, then they're automatically signed up for Medicare through the Social Security Administration. Otherwise, they can go online, they can go into Social Security, we can assist people. But there's two parts of Medicare, basic Medicare, A, which is hospital, B, which is pretty much everything else except drugs, outpatient, flu shots, doctor visits, and then they will, depending on which way they decide to go, whether they want to do a supplemental. There's also Medicare Advantage plans, which kind of cover the health and drug portion. Excuse me. Otherwise, they would have a standalone drug plan to cover their drugs. But they have about a 7-month window, 3 months before the month they become 65 and 3 months after. Mm-hmm. And then contrasting that, a lot of people have that confused with Medicaid, which is state-based. And it's a state, basically income-based. So they have to be lower income. And that's assistance basically through the Office of Public Assistance in Montana. Each state is different. So,
Yeah, and the Medicaid is more that you have health issues and you're lower income, so it helps to address those issues. It's not insurance, whereas Medicare is federal insurance for generalized seniors, and you pay for that by working, I believe it's 10 quarters. You pay through your paycheck, and then you're eligible for the rest of your life. But now, let's say an individual is approaching 65. What are some of the thoughts that they should be thinking about in planning to get on Medicare? You don't just say, oh, it's my birthday. What are some of those thoughts?
Right. Well, like I said, they about 2 to 3 months before your birthday, you should start looking into that and checking, like either they can, like again, Social Security Administration to apply. If they continue to work, they do not have to sign up for Medicare Part B at the time if they have good group insurance until they down the road decide to retire, and then they can again apply for the Part B, which is the doctors and the hospital. Part A is normally paid for. I mean, you've paid for that by your work. I mean, other people, you don't have to be turning 65 if you're on disability, Social Security disability. After it's about approximately 2 years, then they are automatically put on Medicare. So that's another, in our agency, we walk them through that as well.
Mm-hmm. And I know that Medicare is usually paid through Social Security. There are other ways to pay for it, but if you are continuing to work, you're not going to draw Social Security at 65. You still need to contact Social Security and let them know that you have an equal or better plan. Isn't that correct?
Yes. So you don't need to, pay the premium for Medicare if you have a great, really good group insurance, until you decide to retire and lose that insurance, of course. So.
Right. Yeah, because they don't know your situation, and they can't say you don't need it until you tell them they do. But there's penalties associated without informing them or waiting beyond your 7 months, right?
Yes. If you don't sign up and you don't have good creditable, Medicare word, creditable insurance, down the road when you do sign up, there are special open enrollment times, so you can't just sign up anytime. It's January 1st through the end of March, basically, is the general open enrollment if you miss your deadline. And then they penalize you 10% per year back to when you should have signed up. So it can add, depending on how long people wait, can be a hefty additional, penalty. Additional charge, and it never goes away for the rest of your life, basically.
Well, this sounds a little bit complicated, but what the good news is, we have people like you, SHIP counselors, that will help an individual with the number and the website that's on the screen. How do you help these individuals?
So we hope will call and and make an appointment, and then either I've done tons of phone appointments as well as in person, but basically walk them through what they need to do, how far in advance, what their options are, whether they want to go with straight up traditional Medicare, A and B, and a drug plan, and then Medigap, which is Medicare supplemental insurance, or if they want to opt for the Medicare Advantage plan, which that goes by your zip code and the area you live, and they're a little more restrictive on doctors, but it covers health and drugs. So we just kind of go over kind of the options. It's kind of funny because people will come in and say, "Oh, I thought you were just going to tell me this is what you have, what I have, and this is basic. It's easy, and you have a lot of different options that we."
Yeah, you have a lot of considerations, but the SHIP counselor will not decide for you. They will give you the information to help you make an important decision. Well, now, Cheryl, we're drawn to a close so quickly in this segment, but we'll talk about this and so much more in our next 2 segments, so stay tuned. Perhaps our regular viewers have noticed that we've been missing a host for the last several months. In July, our favorite person, Kimmy Everman, unexpectedly passed away, and we'd like to take a few moments now to share some memories that we have of her.
For many of us, watching Aging Horizons with Kimmy on as the host was like talking to a friend, and for Kimmy, that's exactly what it was. She cared about all of the viewers of Montana on Aging Horizons as if they were her personal friends. She wanted each of us to live the best possible life and connect to as many services as possible. She had no greater joy in life than connecting advocates to others that could help Montanans across the state with problems that they maybe didn't know as much about. Losing Kimmy was a great loss to the state of Montana, but the work that she did will live on in the hearts and minds and Rolodexes of so many of us at the state.
So working with Kimmy was always a very fun experience for me. She lit up a room with her smile, and I loved her giggle. She had this giggle that was the cutest, most happiest spreading of joy that I could describe. She also was very passionate about her work, about helping veterans, and about her dog Sophie.
Kimmy's been my friend, my coworker, and my mentor for over 20 years. She has taught me so much about not only Medicare, but working with people. She had a great sense of compassion and love, especially for veterans, animals, and the underdog. She loved working with seniors and people with disabilities. That was her heart. She will be greatly missed.
Aging Horizons has been on the air for over 30 years, and I've had the pleasure of working with these wonderful ladies and everybody in senior long-term care that length of time, including Kimmy Everman. And whenever we got done with the show, I just loved her laughter, which everybody's commented here. It was like we're getting away with something. Isn't this fun? And I will sincerely miss both that and her. Welcome back to Aging Horizons. I'm your host, Brian Lamore. We're continuing our discussion about Medicare, particularly about how you can be eligible for that. What are some of the considerations? And once you're on Medicare, is there resources out there to help you maybe figure some of these confusing programs out? Rejoining us now is Cheryl Peters-Lee. You're a resource specialist with Area Agency 5 out of Butte. And, we have some ABCs, Cheryl, of Medicare. Could you tell us what those are and how that helps serve the Medicare recipient?
Okay, so the basics, of course, Medicare A is hospital coverage, and that, again, if you've worked so many quarters, basically 10 years of your life, it's paid for. And then Part B is doctor visits, outpatient procedures, pretty much everything else except drug coverage. And then the options you have are Part C would be an Advantage plan that kind of is a one-stop shop, takes over for the health and drug coverage compared to just a standalone Part D drug plan, which works with your pharmacies and your drug, prescription drug lists.
Mm-hmm. Now, there's a cost to these plans, Cheryl, and how is that cost covered? Does the individual pay it, Social Security, other sources?
So Part A is covered. You've already paid for that pretty much. Part B, there's a premium depending on your income. This year, mostly, it's about $175 a month, which if you're already taking your Social Security, it's automatically taken out of your Social Security check. If people are not, opt to not take their Social Security, then they're billed in 3-month increments, from Social Security, which they pay every 3 months. I know they can set it up to do it monthly, maybe out of a checking account or something like that. And then the drug plans vary. There are some zero premium Advantage plans, and then the drug plans vary from, basically there's about 22 plans from 50 cents a month all the way up to $105 or something like that. All driven by what your drug list is, what expensive drugs or generics, whatever prescription drugs you take.
Great. Well, now you're a SHIP counselor, State Health Insurance and Assistance Program person, so you help people on Medicare or getting onto Medicare. What are some of the common issues that you see many times that our viewers might say, yeah, I wondered about that?
Right. I mean, there are so many low-income people, or if people are, there are help programs or assistance programs through the federal government and also through the state. Of course, all income and resource-based, basically. Medicare Savings Program, which is basically through Medicaid or through the Office of Public Assistance. Income and resource-based. If people qualify for that, then the state actually will pick up and pay that premium for Part B. And if they're over income for that, there's an extra help program through the federal government or low income subsidy, where they will that helps pay with copays, and also up to a certain amount on their premiums. There are 4 or 5 zero premium plans, again, if they qualify income and resource wise. And then if all else fails and they're a little bit over resources or over income for that, we have a state assistance program called Big Sky RX out of Helena, funded by tobacco tax. I tell people if you've smoked all your life, you've paid for it. But anyway, funded by tobacco tax, and that's a higher income level, and they do not count resources. So they will help up to $42 a month on your premium for your drug plan. So lots of assistance, programs, of course, if they qualify.
Yeah, that's right. Now, we have an 800 number on the screen and a website. Now, the 800 number goes to all our different area agencies on aging, which you're a part of, and there are SHIP counselors like you throughout the state that can answer that phone number. And as you mentioned, there's about 4 programs that can help individuals out with their Medicare payments if they're eligible. The problem is they have different eligibility levels, and a SHIP counselor can help you out. How important are the SHIP counselors, and what are some of their duties and how they help Medicare recipients?
Well, I mean, we meet with people coming on brand new to Medicare, people who are going to retire and now need Medicare, losing their group insurance. And within this last year with the Medicaid unwinding, we've helped so many people transitioning if they're losing their Medicaid, transitioning onto Medicare, or some people can keep certain portions of the Medicaid. Anyway, just kind of walk them through that process and hopefully help them understand and make it a little bit easier to understand, I guess.
Now,
we try.
Now, being a counselor, do you interact with Medicare beneficiaries' children or maybe representatives? Because you can do that if the Medicare patient is maybe a little confused, let's say.
Yes, we do assist. I mean, of course, we have several people come in and even for a husband or a wife or parents, grandparents, or, children if they're on disability as well. So kind of the gamut. I mean, we'll work with anyone and try to make it as easy to understand. I do work with several also of the nursing homes where they'll get a new admission and they either need a new drug plan or, walk them through that, get their drug list. And, so
that's great.
I guess we pretty much, seems like we do everything.
That's right. Well, Cheryl, we're drawn to a close on our second segment here, but as Cheryl has been indicating, we have Medicare A, B, C, D. We have 4 low-income and assistance programs to help individuals with Medicare, and we can work with individuals, guardians, spouses, children, to make sure they get the correct benefits. Now, there's a lot more information in segment 3. Stay tuned.
Montana veterans, your independence matters. The freedom to age with dignity, how and where you want, for as long as possible. Please help us improve long-term veteran care in Montana by taking a short online survey. Go to veteransurvey.mt.gov Your long-term independence is our priority. Go to veteransurvey.mt.gov and help us get it right, Montana. This message brought to you by DPHHS, the Montana Veteran Affairs Division, and this station.
I take care of my wife at home. When I found out training was available, I said, sign me up. It's made a huge difference.
When my husband was injured at work, it was life-altering. The classes taught me that it's okay to grieve, to ask for help, and to better cope as a caregiver.
My dad lives 4 hours away, and the Powerful Tools classes taught me that it's okay to ask for help. I highly recommend them.
To find out about this course for caregivers, go to powerfultoolsforcaregivers.org.
It's amazing the difference a little training can make.
Out here, we love our animals, from the wildlife to the livestock. Inside, it's the same. They're just like family. We keep them happy and healthy, most of the time. Secondhand smoke puts pets at risk for cancer, feline lymphoma, vomiting, increases the risk of tumors and lung cancer, even causes eye and skin disease. Secondhand smoke puts your pet's life at risk.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're continuing our discussion about Medicare. And in this segment, we're going to focus on area agencies on aging. We have them all over the state of Montana, and they all provide pretty much similar services as to what we've been speaking about with SHIP counselors. But Cheryl, tell us more about what area agencies do and how they're important in the life of a senior.
So we are Area 5, Agency on Aging out of Butte. We do cover 6, Silver County, of course, but the outlying counties. And every agency, I think, has their own, they maybe do more than, we contract out for like senior meals with the senior centers. We do have a senior commodities program that we give out food and distribute, I should say, every couple of months. Again, that's income-based, and they have to be at least 60 years old to qualify for that. In our agency, we have a couple of SHIP counselors, as well as we have the local ombudsman for our area, but we also have the regional ombudsman out of our agency, and there are a couple of my coworkers who work with the VDC, or Veterans Direct Care program, which they help veterans to basically stay in place, and kind of coordinate the Veterans Administration paying the caregiver, usually a wife, husband, family member, to help them to stay in their own homes.
Okay, so the area agency does a lot of things. We call it one-stop shopping. The 800 number that we have on the screen will ring into there. And we've been talking about Medicare and the SHIP counselors, which is a part of what the area agencies do. Now, you mentioned ombudsman. They're nursing home and personal care facility advocates for individuals in there. Can you go a little bit more into what an ombudsman does?
Well, like you said, an advocate for people, residents in long-term care facilities, assisted livings, and nursing homes. They are the advocate for the resident, not the family. So basically, just if there's any issues, complaints about the facilities, complaints about family members, they just kind of another one-stop shop, a different hat. And I don't do that. That's, but we do have them in our office. So same number, and then, they would be able to assist.
Help them with that. Well, now we mentioned information and assistance, and that's really important because that's such a broad topic. What does information and assistance do for seniors?
Basically, people call us with, like you said, a one-stop shop. Questions about anything. We're more of a resource center. If people are asking about home health for their parents or grandparents, we have we give out the home health agency information and, how much they charge and different things like that. I don't know. We get tax questions, put people to the right people, that are helping assist seniors with taxes. Basically anything.
I remember that, people would call in, my parents need someone to help trim their toenails. They need someone to figure out, is there transportation assistance in their community? Or do they need Meals on Wheels or senior center meals? Let's talk about meals. Senior centers and Meals on Wheels, what services do they provide?
So our local senior center here, the Belmont Center, of course, they have congregate meals where people come into the facility, and then they have bingo and all sorts of fun games, and they have health wellness checkups occasionally. They do have a lady that trims people's toenails, like you said, and then they also do the Meals on Wheels, which basically, the home delivered meals. Basically, it's all out of the senior centers, and there's one in Anaconda. NS, we're over all of them.
And home delivered meals are so important is that they bring proper nutrition to individuals who cannot make it into the senior center. And to generalize the senior center, socialization is so important for seniors to actually interact with individuals. The home delivered meals is designed to be temporary until they can get better and hopefully come into the senior center itself. Now they have legal services that they provide also. Can you tell us more about that?
We normally refer people to legal services out of Helena. Every once in a while, maybe every couple of years, we will have the people come to, I think it was 2 years ago, they came to the Belmont Center and assisted people in setting up their wills, power of attorney, anything legal that they needed assistance with. And they just had one in Dillon maybe within the last year. So.
Yeah, it's a great program. I've participated in it also. Well, now, Cheryl, we've drawn to a close on our our third segment here. I'd like to thank you for all that you do for seniors in the Butte area and with this show throughout Montana.
Thank you.
That's great. And for our viewers, again, we're talking about area agencies on aging and all the services that they provide for seniors. Calling the 800 number will bring you into your closest senior center where you can ask about any question about senior needs, senior services, or senior assistance. We've spoken about legal needs. We've talked about congregate meals, home delivered meals, information that, maybe you need a physician in your local area. You don't know where to start or who to contact. Well, they're there to help you out. But they're also there to help you with Medicare. And if you have questions with Medicare, even if there's a possibility of fraud in your bills, they will help you out with that too. For Aging Horizons, I'm Brian Lamore. Thank you for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.